His Excellency, the British High Commissioner, Dr. Christian Turner, and other partners present, the Secretary General of Kenya Red Cross, Dr. Abbas Gulet, the Chair of Council of Governors and our partner, Honorable Isaac Ruto, and other governors present, ladies and gentlemen. I think for me, representing the Minister of Health, sitting there and looking at the kind of gathering we have today, and the kind of statistics which have been given to us, I just have one wish, Your Excellency, and possibly also one regret, that we had not started this process 15 years ago. I think looking at the kind of gathering we have in terms of the partners, in terms of the stakeholders we have today, from the donors to the governors to the Her Excellency the First Lady, I think if this process had been started 15 years ago, I think clearly Kenya today would be the best performing country in terms of MDGs. And so it's a wish and a regret at the same time, because clearly the momentum has picked up quite dramatically since last year. And we'd wonder what we could have achieved if we had started this process 2004, when every country was starting to do the same thing. Unfortunately for us, and this is a Kenyan problem, we like doing things the last minute. You have seen when there's voting, the entire morning is empty. The queues are not there. But then you find the final hour before the closure of the polling booth, you find that Kenyans are fighting to get through the door. And this demonstrates and reflects, I think, what you are seeing today, Your Excellency. Because whereas other countries started running 15 years ago to achieve the MDGs, us, we just woke up last year, to be frank with you. And whereas we have a very great momentum because we can see the kind of stakeholders we have today, I think it's a lesson to be learned that in future, we really have to start doing what you're supposed to do in good time. Us as government, Your Excellency, you are aware that His Excellency the President himself, last year, we did acknowledge that this was a big problem in terms of maternal, newborn, and child health. And I'm proud to say, and this is a fact, that indeed the intervention of free maternity last year, on the 1st of June, was the first intervention of the Jubilee government. It only came 2 weeks after the government was inaugurated. And so, it's true, we started late. But showing the kind of goodwill, the commitment, and the passion which we have today, in terms of people getting together and joining forces, I still believe that even if it's a few months remaining, we can still make a very big ground. And this is confirmed by some of the figures which we have seen. The final slides which Dr. Muragori presented. You have seen that after introduction of the free maternity service last year by the President, within 6 months, we had the number of mothers going to hospitals increasing from 44% to 66%. And we just wonder, if within 6 months you could have achieved so much, what if we started even 5 years ago, leave alone 15 years ago? We could have made a very big difference. As a result, we have saved lives as a result of that intervention. When the mothers going to hospitals, numbers went up to 66%. The maternal mortality rate, Your Excellency, dropped by 8% within 6 months. The child mortality rate, which is correlated to the maternal mortality rate, dropped 15.3%. In terms of mothers being saved, if you calculate, given the numbers we were shown, we have saved about 600 lives within 6 months. In terms of children, number of children saved as a result of the drop in child mortality rate, we saved about 16,000 children. And so, if you try to equate the money we spent in the first 6 months, which is only 1.7 billion shillings as government, and as a result, we saved so many children and so many mothers. clearly we could not have had a better investment as a country than that investment which was introduced by His Excellency the President last year on the 1st of June. And it also shows that before, because this service was not free, there was a problem in terms of accessibility. Mothers did not go to hospitals because they were being charged so much to deliver. And so going forward, I think you can see the kind of difference it can make. Further, if you look at the kind of result we got as a result of waiving the 10-20 shillings rule, which was being charged by dispensaries and by the health centers, the result was remarkable. Just 20 bob waiving resulted in number of Kenyans going to health centers and dispensaries increasing from 12 million to 18 million, Your Excellency. And so it shows that Kenyans, they are constrained financially, and so any kind of intervention which removes that financial burden brings a lot of remarkable and immediate results. So us as a government, Your Excellency, we shall continue with the kind of path we have taken. I think it was indicated that in the current financial year, we have put 4 billion shillings to strengthen that free maternity service. And so when we heard you announce the Beyond Zero, we were extremely excited and delighted because that clearly augmented the kind of interventions the government was put in place. Even more important, Your Excellency, is the fact that the governors, through the Council of Governors chairman, have now committed to join us. Because whereas in the ministry we can be so good in putting policies together, but those policies are just policies, pieces of paper. If that intervention is not cascaded down to the grassroots. And so to find so many governors today here, led by the chair, it gives us a lot of encouragement that indeed the devolution is working. Governor Ruto will tell you that we work together in difficult conditions, like the last 1 month or so. But with the partnership, Your Excellency, I think we can achieve a lot more. And I think that's why this partnership has to be encouraged and work together with the partners as well. I know we got a minute today. The World Bank is here. I can see Country Director, Catherine Freeman of USAID. I can see DFID, Lisa. So we can join forces, UNICEF, WHO. We cannot have better goodwill than we are being shown today. We work very closely with the Global Fund, through Red Cross. Only recently, they did distribute equipment to about 480 facilities across the country. And so it's this kind of partnership which has to be encouraged because it is saving lives. And I think as you do your reports, annual reports, ladies and gentlemen, as donors, please indicate to your citizens in your countries the kind of difference your interventions is resulting in our country in terms of saving lives of mothers and children. And so, Your Excellency, we are delighted today that we are here to basically accept this new initiative and to join you in Beyond Zero, basically going mashinani. I know you've been with us now this second day in the week. We were together on Monday. On Friday, we are going to Homa Bay. And clearly, you cannot ask for more from the First Lady. And we cannot ask for more from the spouses of the governors who are here today. And so let's join forces. And I'm sure we can report remarkable progress when the close of the MDGs come next year. And so with those few remarks, it's now my pleasure and privilege to invite Her Excellency the First Lady to make her remarks. Thank you very much.
Thank you very much. Good morning. Distinguished guests, ladies and gentlemen, it gives me great pleasure to be part of this very important meeting to deliberate on a matter of great national importance, accelerating attainment of Millennium Development Goals 4 and 5, and more specifically, ending preventable maternal and newborn deaths in our country. Childbirth should be a joyous moment for families and communities. Sadly, many times in Kenya and around the world, it becomes a period of loss and mourning. Too many women and newborns are dying unnecessarily. In this country, we lose over 5,500 mothers every year, a statistic too hard to take as normal in this age of development and 50 years of post-independence. These statistics indicate that we have lost 18 to 20 mothers. We will have lost 18 to 20 mothers by the end of today, which is equivalent to an 18-seater minibus with pregnant women crashing and killing the passengers every day. Ladies and gentlemen, this is unacceptable. Most of these deaths are avoidable and indeed preventable. With less than 500 days remaining, Kenya is clearly off track to achieving MDGs 4 and 5 on maternal and child health. There are opportunities to reverse these trends, and I appreciate the efforts the government is making through free maternity services and improving the skills of health workers. I also take this opportunity and applaud the dedication of all health workers who often have to work under very difficult circumstances to save the lives of women and babies around the country. The Constitution of Kenya 2010 and its devolved health services have given us the opportunity to tailor interventions according to the specific needs of the different communities, thus bringing services closer to the people and increasing access. In doing so, the goal should always remain to reach every family. I have demonstrated through the Beyond Zero campaign that public-private partnerships can go a long way in supporting the improvement of the health status of our women and children. Excuse me. Ladies and gentlemen, reducing maternal and child deaths requires concerted multi-sectoral investments. Hence, the other social determinants that we must address include education, especially of girls, gender equality, roads infrastructure, sanitation, clean water, amongst many others. Our health systems must deliver for our mothers. We must therefore prioritize maternal and newborn survival and mobilize resources at all levels. As leaders, partners, and donors, each one of us wants the best value for money. Hence, we must invest in evidence-informed interventions that demonstrate higher returns so that many lives are saved and more disabilities averted. But primarily, we should, in whatever we do, continue to be accountable to the families and communities. It is important for us to equally invest in increasing demand and utilization of health services by the community. As we improve the health-seeking behavior of the community, the health service provision must be ready to meet this increased demand. Finally, I leave you with this quotation from Dr. Margaret Chan, Director General of World Health Organization, who said, "The obstacles that stand in the way of better health for women are not primarily technical or medical in nature. They are social and political, and the two go together." With those few remarks, ladies and gentlemen, I now declare this consultative meeting on maternal and newborn health officially opened. Thank you.
Let us once again put our hands together for the First Lady. And particularly for the energy she has brought to this subject, even literally through the Beyond Zero campaign that involved 2 marathons. We had the half marathon here in Nairobi, which covered 21 kilometers.